Hi, this is Reed Jacobs with Faith and Hope Hospice, bringing you another COVID conversation. Today we're meeting with Kayte Thomas. And Kayte, can you tell us a little bit about yourself and the work you do?
Sure. Thanks for having me, Reed. So my name's Kayte Thomas. I'm a licensed clinical social worker in North Carolina and a certified clinical trauma professional. Some of the work that I do a couple of different roles. I work as an employee assistance program counselor. And what that is probably really important for people to know about. Employee assistance programs are part of a benefit that employers often give to workers, and they're free access to resources such as mental health professionals. So we get a lot of calls throughout the day, a lot of which are often trauma calls or crisis calls, but also people just wanting to talk about stress or life issues. And so it's really important, but I think a lot of people often don't know that we exist.
Hmm.
So if, people who work at a company should ask if they have employee assistance program benefits. In addition to that, I also do some clinical supervision for newly licensed professional social workers. So in addition, I'm also an adjunct professor at Baylor School of Social Work, where I'm also working on my PhD as well. So I do a couple of different roles, lots of trauma-focused work, and a lot of it's really great.
Yeah, sounds like it. And that's a really good resource to know about the Employee Assistance Program, because I know a lot of people are going to be needing some counseling support, and that might be an option that they didn't know was available to them.
Mhm. Yeah, so they can always ask at their HR department if they have one.
Okay. Um, so the topic that we're talking about today is vicarious trauma. And can you tell us just a little bit about what is vicarious trauma and how is it different than regular trauma?
Yeah, sure. So when you're talking about a concept like vicarious trauma, what you're really talking about is an umbrella term that encompasses four different things. What those things are vicarious trauma, secondary traumatic stress, and then also things that you may have heard of, such as compassion fatigue or burnout.
Hmm.
Sometimes those terms are all used interchangeably, but they're actually different things.
Okay.
So when we talk about vicarious trauma, we're talking about indirect trauma. So that's trauma that you've heard from somebody else's trauma experience. So it didn't happen directly to you. You may have heard about it through news stories or watching videos or through your own professional work. But it's trauma that happened to somebody else and then traumatized the listener.
Okay.
Um, when we talk about secondary traumatic stress, that's often interchanged with vicarious trauma. But a very easy way to conceptualize that is if you think of, so somebody who has been traumatized may develop post-traumatic stress. Somebody who has had vicarious trauma may develop secondary traumatic stress.
Oh,
So
okay.
they're two separate terms.
Okay. And so I'm guessing if people are doing a lot of watching the news or reading news reports or social media that's all hyper focused on COVID and the hurt it's causing, um, I'm guessing binging on that might trigger vicarious trauma.
It can, yeah. So we know that some of the risk factors are being exposed to the secondary trauma frequently. But it doesn't mean necessarily that just because you are having a large amount of input of that, you're going to be traumatized. It could be something that, an individual hears one story that's incredibly traumatic, and that's enough to cause a problem for them.
Mm-hmm.
Or it could be repeated exposure, such as people who work in helping professions, who have that constant exposure to other people's trauma, which slowly kind of erodes and causes an ongoing issue.
Hmm. So we might start seeing vicarious trauma showing up in healthcare providers.
Some of it is that so this pandemic is different stress than we're used to seeing, and different types of trauma than we're used to seeing in helping professions. But the pandemic is also very interesting because it can cause a retriggering of previous trauma for people.
Hmm.
So for example, if somebody grew up in an unsafe home and is now in a safe home but has to be indoors all of the time, it can trigger traumatic memories. and responses that they're not aware of. So in people that we're serving, we may be seeing a heightened level of re-triggered trauma, which is going to make their presentation a little more intense and a little more stressful. And I think in turn, that can certainly cause more vicarious trauma in the people who are helping them. I also think that for all of the first responders, especially people who are working in places like, New York and California, where they're really having a large number of deaths and sicknesses with that, I think with everything that they're exposed to and everything that they're witnessing, I would expect to see some vicarious trauma as well.
Here at Faith and Hope, one of our colleagues actually was diagnosed and hospitalized with coronavirus or COVID. He was in the ICU for a while. I know it's going to be a while before he's able to return to work, but he was able to return home. So thankfully the medical interventions helped, but it's going to be a long path. And I think that made it a lot more real for us.
Yeah, and that actually is one of the risk factors to developing more complications with vicarious trauma. If it's something that hits close to home, whether it's because you share personal characteristics with somebody that you heard about, or if it's something that happened, in your coworker or in your local community, it's also likely to be a little more difficult for you to process and work on. So that is another risk factor as well.
Okay. Curious, is vicarious trauma just something that helping professionals, nurses, doctors, social workers, is that just something we experience it, or is it other people too?
Yeah, no, so it's not only helping professionals. I think there's a greater likelihood of people in helping trauma just by the nature of their work. But this can happen to anybody. It can happen to people who are, if they're exposed to overwhelming news stories, that can happen. It can happen to teachers or daycare providers who, if something happens to the child and they hear about it, then that can overwhelm them as well. It really, trauma doesn't discriminate in any way. It can kind of happen to anyone, and we can talk about risks and we can talk about factors that contribute to it. But I think it's definitely important to note that it can happen to anybody.
Okay, that is good to know. So we've talked about exposure or frequent exposure, being on the front lines, having someone who's close to you or similar to you. Are there any other risk factors?
Yeah, so one of the things that's really important to be aware of is your own trauma history. So I'm sure you've heard of ACEs before, adverse childhood experiences. If, a lot of people in helping professions, I think it's statistics around 60% of people in helping professions actually have trauma history of their own. Wow. And that past trauma history can complicate how you are coping with things as well. So it's really important to be aware of that. If there are any past experiences for you as well.
In social work school, self-awareness is something that is really important and that we try to focus on so that we're aware of it.
Yeah, that matters. I think also some of the workplace conditions matter. And in some situations, so if you're working in an emergency room, for example, you can't really predict the number of cases that you're going to get, and you can't really say, oh, my caseload's too high right now, I'm not going to do anything else, right? Yeah. But as much as employers and agencies can to try to reduce the stress load on their employees, also helps to mitigate some of the issues with vicarious trauma.
Okay. How might COVID trigger or increase vicarious trauma in ways that other events haven't, or is there anything unique about COVID?
Well, so I know we talked about that, a little bit already, but one of the things to remember is that everybody's dealing with this pandemic right now. So every single worker, every single helping professional, every single carer, if there's a family caregiver, daycare providers, all of those people, we're all experiencing the pandemic as a society. So it's not the same as if you are experiencing a vicarious trauma as an outsider looking in. You're now experiencing somebody else's trauma as someone who's also experiencing it. Even though everybody's experiences may be different, and you as a helping professional may not, there may not be somebody, say, in your household who's directly ill, but you're still experiencing the stress of being under lockdown, the concerns of, watching the numbers all of the time, the unknowns, the worries and all of that. So your stress level is already heightened.
Mm-hmm.
And even though it, like I said, it may not be a direct trauma, you're still experiencing this sort of society-wide trauma.
Mm-hmm.
And that's going to complicate the way you're coping with dealing with people who have, COVID infections, deaths, things like that, especially because you can look at that and say, wow, that could be me. And that's one of the risks of having issues with vicarious trauma is recognizing that there's really not that much different between you and the person that you're supporting.
Mm. Yeah. And even people who don't work in healthcare, they don't work on either front lines or um, if they've not been able to work and are just staying home. I suppose just that experience. But then when you do go out on normal errands, going to the grocery store has become this thing where you're putting yourself at risk. You're
Right.
potentially exposing yourself, and um, even and we should be wearing face masks and doing hand washing and hand sanitizer. But I guess just the experience of having to do that um, is putting us at higher risk.
Mm-hmm. Well, and so it's interesting that you bring that up, because like we were talking about, it's important to be aware of any kind of past trauma and how that can be re-triggered. So things like wearing a face mask, I know there's different perspectives on whether that should be done or not, and lots of internet arguing right now. So regardless of your perspective, that can be very difficult for people who have, say, anxiety disorders or who have past history of trauma, if there's somebody who's been physically or sexually assaulted, if they've ever been in any kind of medical procedure, if they've ever had an experience where they felt like they couldn't breathe, having something covering their face can really be a re-triggering, traumatic event. So they may find that they're having more anxiety and panic attacks going out. And it's a seemingly simple thing, like, okay, go out and wear a mask. But if you're dealing with somebody who has a lot of other trauma going on, and then there's those little things that are adding into it that's making their day even harder to get through, you're really going to see an increase in symptoms and trauma symptoms and anxiety and things like that. So I think it's important to be mindful of how the little interventions that are being put in place can really have a cumulative effect.
Yeah, because everyone, their life is still going on, whatever life was for them, whatever stressors they had, whatever illnesses, those are still there. But and there's this COVID thing on top of all that.
Right. And so many expectations and pressures on everybody right now. There's people who have lost jobs. There's people who are expected to work while there's children running around the home and, homeschooling them or whatever online learning they're doing. There's people who are being asked to return to work who don't feel like it's safe. That's going to increase trauma symptoms as well. So I think as much as we can be sort of mindful of each other and compassionate towards each other during this time, that's really going to help regardless of the situation we're all in.
That's good to remember. Is there a way to reduce a person's risk for vicarious trauma or any long-term effect from it?
So I think that comes in several forms. So we can't just ask the individual to take care of their risk, I don't think. We also have to ask the agency, and we have to look at society and how all of those things interplay. So as we mentioned, it's good to be aware of individual past traumas, right? It's good to be aware of boundaries. That's why we're taught, especially, social workers, we're taught a lot about boundaries and how to keep healthy and professional boundaries in place. Really making sure that you follow those expectations and those standards that are put in with the code of ethics and all of our training is there for a reason. It's there to help protect you, and it's there to help protect your client first and foremost. But anytime there's boundary violations, that can really increase your risk for that. You also have to look at things like agency conditions. How many people are you expected to be seeing every day? There's a difference between if you're talking to 10 people who may be experiencing trauma versus if you're talking to 30 people each day. And that kind of thing matters. It matters if you're able to take breaks, if you're able to take regular time off. So, if a company is not providing, say, paid time off to its employees, those employees are going to be at greater risk of suffering issues from vicarious trauma than people who are able to comfortably take time off. At the larger sort of macro level, though, if you're working in an area that has a lot of systemic failures, so I would think, people who are working with those who have a lot of barriers to care, let's say populations of people experiencing homelessness, maybe people who are engaged, you're interacting with the prison system or the legal system, where there's just lots of different barriers and issues, they're going to experience a lot more problems from vicarious trauma because of some of the frustrations and the feelings of powerlessness when dealing with that and trying to help navigate those things. So when we ask about what can we do to mitigate risk, we have to ask about what we can do not only individually, but also collectively. And I think it really needs to be an ongoing sort of broad conversation.
Yeah, that systemic part and feeling powerless leads to feelings of helplessness, then hopelessness, which are big triggers for depression, and that can get dangerous for some people. So it's good to be aware of that. And here in Los Angeles County, there's a lot of homeless people, and there's been a lot of talk about how to keep them safe and finding places for them to live for now that is safer than on Skid Row where they're 4 feet apart. Yeah. And I think, go ahead.
Oh, I'm sorry. I was going to say, that's actually really, there's two things that I thought of when you were talking about that. One is that trauma is trauma. So our bodies and our minds don't really recognize the difference between direct trauma or indirect trauma if it's something that's traumatizing you, because it's trauma, right? So I think it's important to remember that just like you would see increased trauma symptoms with somebody who's feeling helpless and powerless in a situation where trauma was involved, you're going to see the same thing in people who are experiencing vicarious trauma and they're feeling helpless and powerless. So that in and of itself is a risk. One of the ways to help mitigate that, though, is to focus on what you were able to do and what went right. Because if we're focusing on feelings of powerlessness, if you're in a helping profession, or if you're a caregiver, or if you're a teacher or a daycare provider, right, you're still doing something. You are still actively participating in something that is beneficial. And if you can remind yourself to focus on what it is that is within your control and what it is that you were actually able to do, that can help reduce some of those feelings of powerlessness and helplessness too.
Yeah. That makes me think a way that someone can take some power over it, regain some of the power in doing something they are able to, is maybe advocating for their workplace to let us have more breaks. Or can we work in different shifts where, I don't know, half the staff comes in the office one day and the other half comes in on others. Or thinking about ideas and not just waiting to see what happens and trying to take a more active role, or maybe discussing with their colleagues. I know a lot of our clients have loved ones who are in skilled nursing facilities and assisted living where they're not letting anyone come in who's not a resident. So families aren't being able to be there. So maybe if they're able to come up with the ways to still engage with their families.
Yes.
Yeah.
Yeah, I think that's another one of those unintended consequences, like the issue we talked about with face masks being, re-triggering trauma. If there's a need to keep somebody isolated for safety, the intention is to keep them healthy and alive and well, and that's necessary. But the unintended consequence is then they don't have human contact. They don't have the support from others. They're losing a great deal of their social network. And we know that that is another risk factor for trauma and difficulty coping with things. So, if there's creative ways for people to make sure that they're still able to engage, I don't know about the rules in the facility, but if they're able to have regular Zoom calls, or people who can come, outside the windows, or, within a certain distance that's deemed safe, whatever kind of interaction and support is available is definitely necessary.
Yeah, that's good. Let's see. So we're already talking about some of the ways to reduce the risk. Are there any that we haven't hit on?
Um, I think we covered most of them.
Okay.
I think one of the things that's really important, though, is to make sure that you have like a designated professional to talk to with things. So in your place of employment, there should be a supervisor available to talk about difficult cases with. Or, maybe you have your own therapist that you go to, and there's absolutely nothing wrong with having a therapist just to talk about the difficulties that you're dealing with in your line of work or in your daily life. But being able to have somebody to kind of process all of those things with and talk about those things with can really help reduce risk over time too.
Okay, good. And I know there's a lot of now online resources for counseling, video calls like we're doing. So even though we're socially distanced, we are still able to engage with a therapist.
Right, yeah.
What are some early signs and symptoms to look for when vicarious trauma is being experienced?
Yeah. So I think the important thing to remember is also, just like any trauma, it can be something that you have symptoms just for a couple of days if it was overwhelming.
Hmm.
And just because you feel that there is, a level of trauma by hearing or seeing all these other things, does not mean that it's going to turn into a long-term issue like secondary traumatic stress. But some things that you might notice is, difficulty concentrating, feelings of irritability, either fatigue or difficulty sleeping, maybe some physical symptoms, headaches, stomach aches, loss of appetite. Um, and it's really when that is allowed to continue for a while that you start seeing more chronic issues. Things like an increase in substance use, things like difficulties in interpersonal relationships, trouble doing the essential functions of your job. Maybe changes in the way that you view the world, loss of compassion and empathy, and really a loss of your sense of purpose after a while. And that's really where you start to see some of that compassion fatigue come in, is where it's really, it's changed the way that you view the world in a negative way because of these repeated experiences. Whereas burnout is more of that sort of physical and mental exhaustion that comes from being overworked and not taking enough breaks, not having enough rest time and support and boundaries, and not having enough time for your own self-care as well.
Okay. So my next question was going to be how to manage it. It sounds like self-care might be one of those ways.
Yeah.
Can you tell us more about self-care?
I feel like sometimes self-care is what we tell everybody to do, and it sounds like such a simple thing. We're like, oh, go focus on self-care, right? And there's a couple of problems with that, actually. A lot of times when I ask people what they do for self-care, the first thing they say is, what is that? They don't have a frame of reference for that because they're so busy all the time. Something just for them is not coming into play regularly. And that's a good sign that the people are overworked and overstressed and overwhelmed. On the other hand, sometimes I feel like it's a little trite to say focus on self-care, because we say, oh, go for a walk, take a bubble bath, make sure you're resting a little bit. And those are very important things to do. They should be done regularly. It's, you have to be good to yourself and you have to do things that you enjoy. But when we're talking about something that is sort of chronic and systemic, we can't just focus on individual self-care. We have to focus on community care as well. And what that looks like is making sure that everybody has, access to safe and healthy options. Making sure that you as an individual worker are able to access that therapist that you need to talk to is only possible if we have healthcare available for everybody. If you can't access them, it does absolutely no good to say, go focus on self-care once a week with a therapist, right?
Right.
So we have to, again, look at both individual and systemic issues. I think it's important, though, to make sure that you're regularly self-assessing for any kind of signs, checking in, am I feeling more irritable? Am I feeling more fatigued? Am I feeling more overwhelmed? And is there anything that I can do to mitigate that? But also having some conversations with your friends and loved ones about ways that they can be supportive and understanding too. If they know that you're working in an environment that's very high stress, even though we may not be able to talk about what we're dealing with every day because of confidentiality and privacy, if they notice that you're feeling overwhelmed or tired or grumpy, just being a little more gentle with you helps as well. And there's another resource that I really like. There's a couple of options available for professionals to sort of test their level of vicarious trauma and compassion fatigue and all of that. The resource that I like is called the Professional Quality of Life Scale.
Okay.
And I like that because in the scoring section, it actually totals up vicarious trauma, compassion fatigue, and burnout for you based on all of the questions. So you can really differentiate what it is that you're experiencing and your level of risk.
When do you know it's time to get professional help?
Well, so my answer would be that there should always be professional help available. I really think it's just so important that everybody has a supervisor they can debrief with, their own therapist to talk to, or something like that in place. Because if you're recognizing signs of a problem, it means that you've waited too long. However, the time, if you don't have all of that in place, it's just important to know that if you're having any kind of stress symptoms, if you're having, things like difficulty sleeping, nightmares, intrusive thoughts, problems with engaging at work, problems with engaging with interpersonal relationships, it's definitely time to seek some support for that and see what you can change or scale back a little bit too.
Okay, great. And I just want to say I could talk to you all day about this and other topics. So I certainly appreciate that, but I know I do want to be conscious of your time. Is there anything else that you would like to share? Maybe something that we haven't brought up already?
So yeah, there actually is. I think it's wonderful that you're focusing on letting people know about vicarious trauma and how to recognize that. With any kind of trauma, though, the flip side and the important thing to remember is that there's also resilience. We can't really have the discussion of one without the other.
Yeah.
So while some people may experience vicarious trauma from the work that they're doing right now, they can also experience vicarious resilience, and that's exactly what it sounds like. A positive impact on their worldview, a positive impact on their relationships, an increase in personal growth from watching, the incredible ways that people are coping with everything, and seeing how everyone else is growing and handling the issues that they're dealing with as well. So, I never want to focus on trauma work just being negative. It's actually wonderful and rewarding, and you see people overcome issues and grow in dynamic ways all of the time. And it's such a beautiful thing to witness that really that has a positive impact on the people who are they're supporting them as well.
Yeah. Katie, thank you so much for being with us. I certainly appreciate your help. We'll have this video posted on the Faith and Hope Hospice blog, and I'll include some resources on there as well about vicarious trauma and rating scales and things like that. I'll also put a link to Katie's blog that is excellent, so I recommend it. So thank you. I hope you have a good day.
Yeah, thank you so much for having me. Take care.